Initiative is set to launch, and we've told you about this program for the last couple of years. Our beloved Attorney General, Alicia Limtiaco, is here along with Mike Perlitsky. He's the DEA resident agent in charge. They're going to tell us what's going on with this. Hafaday, and welcome back to both of you.
Hafaday. Thank you very much, Jason.
Okay, so let's get up to speed. Where are we right now with the Take Back Initiative? And as far as the calculus goes, how has it changed either for the better or, perish the thought, have we regressed in any way over the past couple of years as far as, what's been going on with the Take Back Initiative?
Well, the National Take Back Initiative on a national level, we are at the sixth opportunity to outreach to the community with regards to prescription drug medication and abuse of prescription drugs. Over the past several initiatives, we believe, both DEA as well as the U.S. Attorney's Office, that it's been successful. Aside from the collections themselves, what really matters, just as importantly, is the awareness, the public awareness that the community is able to gain from knowing the risk of prescription medication when it's not used appropriately, and also the environmental health risks that come with improper disposal.
Mm-hmm. Now, Mike, the last time you were here, we were talking about the proper disposal, as the AG just said, about getting rid of exactly what is a prescription drug. But does this also kind of lead over into the over-the-counter medication as well?
Yes, it does.
Okay.
The thing we want to make sure is we give people the opportunity to dispose of their prescription drugs, be it unused, unwanted, unneeded, but anything that you want to get rid of, we'll get rid of it in an environmentally correct way. We don't want to see people dumping things down the drain, flushing things down the toilet, because the studies have shown that these medicines are ending up in water supply. So what we're trying to do is do the right thing. But in addition to doing the environmentally correct thing, we want to make sure that we're advising parents that they need to lock these things up and treat it like anything else that's dangerous. You wouldn't leave a knife out on the table, and we're asking that parents be cognizant of that these prescription drugs and over-the-counter medication can be dangerous, and that they need to lock those things up. They need to have accountability for it. 10% of youth admit to using over-the-counter cough medicine to get high. That's a large number. And that's those that have admitted to it. So, realizing that kids have access to the internet, they do talk to each other, and they're curious about things. That's why you need to really take the opportunity to lock those things up and get rid of them at one of the take-backs if it's unused, unneeded, or expired. Mm-hmm.
And I just realized I was calling you AG. You are, of course, the U.S. Attorney, so it seems like disposing, my brain might have been in the disposing bin, hopefully, but of course the U.S. Attorney for Guam and the CMI, Alicia Limtiaco. A lot of people don't realize that even though you guys actually have these established events, just flushing them down the toilet, and getting back to the point about proper disposal and environmentally safe, chucking them out the window, flushing them down the toilet, like putting them in a hefty bag and waiting for DPW to pick them up. That's not the right way to go about doing this.
That's correct, Jason. And DEA as well as the FDA have, I believe, very appropriate, very useful information on their websites. So our general public can log on to their computers, go to the websites, and there is, again, a good significant number of different ways in which a person in a family or any business can properly dispose of prescription medication or over-the-counter drugs.
Mm-hmm. Now, what else can you tell us about the program? What else should the community know?
Well, part of our public awareness is to speak to our community about the youth abuse of prescription medication, and also to raise awareness about also abuse among our elderly population. And again, there have been recent studies that have been taken across the country or prepared across the country that speak to 17%, for example, of Americans over the age of 60 have been at one time or another abusing prescription medication. There have been studies that have shown that this may be occurring because you may have a situation where an elderly person or manamku is no longer dealing with issues like raising families, going to work, and so there may not be as many family members around or loved ones who can help monitor their behavior, how they're doing. And so you might have a situation where someone is perhaps taking prescription medication and become addicted to it without even realizing it, and no one around to really help them with this situation. The other reports that we see speak to perhaps an over prescriptions, too many drugs that are being prescribed to our elderly population. And again, our elderly not necessarily being fully aware of the risks of addiction because they're prescribed. And so just when we're talking about our youth as well as our elderly population, many times people, of course, will think that because it's prescribed, it's safe to take regardless. And so that's part of the awareness campaign, is to let everyone know that we've got to be very careful. We need to monitor the types of drugs that are being prescribed, the dosage, whether it's proper dosage, whether or not it's being shared to those who are not part of the prescription. All of these are risk factors, and that certainly some of these drugs are lethal, and if they're again not monitored or taken correctly, can certainly risk one's health and can result in death, which of course would be tragic.
We do have to go to commercial break, but is there a number where people can call very quickly to find out more?
Certainly, and I will relate to
the best thing to do is to go on DEA.gov or FDA.gov.
All right.
That's where you'll find a lot of the information.